Good morning, everyone. Bonjour à toutes et à tous. Today, we'll provide an update on the national epidemiology and modeling work that informs the ongoing management of COVID-19 in Canada. To date, there are about 52,000 active cases in Canada, and despite having over 315,000 cumulative cases, less than 1% of the population across the country has tested positive for COVID-19 to date. This is an important reminder that the vast majority of Canadians remain susceptible to infection. We'll continue rapid growth in daily case counts, rising numbers of hospitalizations and deaths, and spread in high-risk populations and settings. There is urgency to quickly bring infection rates down across the country.
Bonjour à toutes et à tous. Aujourd'hui, nous
Hello,
ferons le point
everyone.
sur les travaux
Today, we'll be providing an
d'épidémiologie et
update
de
on the national
modélisation
epidemiology and modeling work that informs the ongoing management of COVID-19 in Canada. To date, there are about 52,000 active cases in Canada, despite having over 315,000 cumulative cases this week. Less than 1% of the population across the country has tested positive for COVID-19 to date. This is an important reminder that the vast majority of Canadians remain susceptible to infection. With continued rapid growth in daily case counts, rising numbers of hospitalizations and deaths, and spread in high-risk populations and settings, there is urgency to quickly bring infection rates down across the country.
Slide 2. The national epidemic curve shows that case counts have far surpassed peak levels seen during the first wave. An average of about 4,800 cases are now being reported daily. Moreover, epidemic growth is continuing at a rapid pace, and about 15% more daily cases are reported this week compared to the last.
Diapositive 2. La courbe épidémique nationale indique
Slide 2. The national epidemic curve clearly shows that case counts have far surpassed peak levels seen during the first wave. An average of about 4,800 cases are now being reported daily. Moreover, epidemic growth is continuing at a rapid pace, with about 15% more daily cases reported this week compared to last.
Slide 3. Rapid growth nationally is being driven primarily by the 6 provinces outside of the Atlantic bubble. Although regional differences remain, all of these jurisdictions are currently experiencing steep increases in infection rates. Over the past week, each of these provinces has marked the highest daily case counts to date.
Diapositive 3.
Rapid national growth is being driven primarily by the 6 provinces outside of the Atlantic bubble. Although regional differences remain, all of these jurisdictions are currently experiencing steep increases in infection rates. Over the past week, each of these provinces has marked their highest daily case counts to date.
Slide 4. The map of COVID-19 spread in Canada shows health regions with the highest 14-day incidence rates of COVID-19 in the deeper shades of blue. There are now 48 health regions with infection rates over 50 cases per 100,000 people, 9 more than we reported 3 weeks ago, indicating that the virus is spreading across a wider geographic area within Canada. Nunavut is now in the deepest shade of blue. The territory first locally acquired cases reported on November the 6th has now quickly grown to 70 cases within a 2-week period. Community spread in some areas has necessitated a 2-week territory-wide restriction period. Nova Scotia is another area of concern. While infection rates are low, several recent cases cannot be linked to other known cases, a sign that the virus is spreading undetected in the community.
Diapositive 4.
The map of COVID-19 spread in Canada shows health regions with the highest 14-day incidence rates of COVID-19 in deeper shades of blue. There are now 48 health regions with infection rates of over 50 cases per 100,000 people, 9 more than we reported 3 weeks ago, indicating that the virus is spreading across a wider geographic area within Canada. Nunavut is now the deepest shade of blue. The territory's first locally acquired case, reported on November 6th, has quickly grown to 70 cases within a 2-week period. Community spread in some areas has necessitated a 2-week territory-wide restriction period. Nova Scotia is another area of concern. While infection rates are low, several recent cases could not be linked to other known cases, a sign the virus is spreading undetected in the community.
Slide 5. The time-varying effective reproduction number, or RT, represents how many people are being infected by each new case. When each new case infects less than one person, the epidemic will die out. Nationally, the RT has been greater than 1 since the end of August, meaning that every 100 cases in Canada passes the virus to more than 100 others, and so on, with each new generation of spread getting larger.
Diapositive 5.
The time-varying effective reproduction number, or RT, represents how many people are being infected by each new case. When each new case infects less than one person, the epidemic will die out. Nationally, the RT has been greater than 1 since the end of August, meaning that every 100 cases in Canada pass the virus to more than 100 others, and so on, with each new generation of spread getting larger.
Slide 6. The percentage of people who test positive is another important indicator to monitor how hard we are looking to find cases and to gauge how much the virus is spreading. Based on the World Health Organization international benchmark, countries should aim to keep the percentage positive to under 5%, as anything above this could indicate we're not testing enough. The average percentage of people testing positive in Canada has been increasing for many weeks and is currently over 6.5%. This is a clear sign that transmission has increased. Spikes of up to 10% or higher test positivity in several provinces signal a need to increase testing to detect and isolate a growing number of cases in the community.
Diapositive 6.
The percentage of people who test positive is another important indicator to monitor how hard we are looking to find cases and to gauge how much the virus is spreading. Based on the WHO international benchmark, countries should aim to keep the percentage positive to under 5%, as anything above this could indicate that we are not testing enough. The average percentage of people testing positive in Canada has been increasing for many weeks and is currently over 6.5%. This is a clear sign that transmission has increased. Spikes of up to 10% or higher test positivity in several provinces signal a need to increase testing to detect and isolate a growing number of cases in the community.
Slide 7. Across Canada, the incidence of COVID-19 has been consistently high among young adults aged 20 to 39 years since July. However, incidence has been steadily increasing among individuals 80 years of age and older for several weeks. Elderly adults in this age group are at highest risk of severe illness, outcomes, and death, and now have the highest reported incidence rates nationally as well as regionally in Alberta, Quebec, and Ontario.
Diapositive 7.
Across Canada, the incidence of COVID-19 has been consistently high among young adults aged 20 to 39 years since July. However, the incidence has been steadily increasing among individuals 80 years of age and older for several weeks. Elderly adults in this age group are at highest risk for severe illness outcomes and death, and now have the highest reported incidence rates nationally as well as regionally in Alberta, Quebec, and Ontario.
Slide 8. COVID-19 spread into high-risk populations and settings is very concerning, particularly as more and larger outbreaks are being reported in long-term care homes, healthcare settings, and Indigenous communities. Outbreaks in long-term care homes put elderly residents at risk of life-threatening illness. Outbreaks in healthcare settings put an increasing strain on health system capacity and directly affect the health and wellness of patients and our healthcare workforce that is increasingly exhausted. Indigenous communities are reporting rising case numbers, with approximately 1/3 of all cases currently active and about 12% of these in hospital. Everywhere, community transmission means growing numbers of cases linked to schools, including some school-based transmission, putting increasing numbers of students out of school, adding to the already heavy burden on hardworking teachers, administrators, and families. Many outbreaks are linked to informal social gatherings with family and friends, where public health practices such as physical distancing and masking are not being consistently observed. These events are amplifying COVID-19 spread in many areas and imposing a heavy strain on public health and healthcare systems for testing, tracing, and follow-up.
Diapositive 8. La propagation de la COVID-19 dans les
COVID-19 spread into high-risk populations and settings is very concerning, particularly as more and larger outbreaks are being reported in long-term care homes, healthcare settings, and Indigenous communities. Outbreaks in long-term care homes put elderly residents at risk of life-threatening illness. Outbreaks in healthcare settings put an increasing strain on health system capacity and directly affect the health and wellness of patients and our healthcare workforce that is increasingly exhausted. Indigenous communities are reporting rapidly rising case numbers, with approximately 1/3 of all cases currently active and about 12% of these in hospital. Everywhere, community transmission means growing numbers of cases linked to schools, including some school-based transmission, putting increased numbers of students out of school, adding to the already heavy burden on hardworking teachers, administrators, and families. Many outbreaks are linked to informal social gatherings with families and friends, where public health practices such as physical distancing and masking are not being consistently observed. These events are amplifying COVID-19 spread in many areas and imposing a heavy strain on public health and healthcare systems for testing, tracing, and follow-up.
Slide 9. Hospitalizations have been increasing for many weeks, following consistently elevated disease activity over the past 2 months. Over the past week, an average of almost 1,800 people with COVID-19 are being treated in Canadian hospitals on any given day, including over 375 people in intensive care units. The strain on health systems has resulted in hospitals having to postpone important medical procedures, while critical care beds for COVID-19 patients have reached or are at near maximum capacity in some areas. Even when hospitalization is not required, prolonged illness and complications can occur and affect people at any age.
Diapositive 9. Comme prévu, nous avons observé une augmentation.
Hospitalizations have been increasing for many weeks, following consistently elevated disease activity over the past 2 months. Over the past week, an average of almost 1,800 people with COVID-19 are being treated in Canadian hospitals on any given day, including over 375 people in intensive care units. The strain on health systems has resulted in hospitals having to postpone more important medical procedures, while critical care beds for COVID-19 patients have reached or are near maximum capacity in some areas. areas. Even where hospitalization is not required, prolonged illness and complications can occur and affect people at any age.
Looking to the experience of other countries, many of which have been ahead of Canada's trajectory, helps us to anticipate what we might expect to see here in the coming weeks. Several Western European nations that experience resurgence are seeing hospitalization rates approach or surpass the height of the first wave, which is causing immense strain on their health systems. In response to surging hospitalizations, these countries close non-essential businesses and ask citizens to limit outings to essentials while keeping schools open. As a result, some countries, including France and Belgium, are beginning to see a decline in disease activity.
Diapositive 10. Si l'on s'intéresse à l'expérience d'autres pays,
looking to the experience of other countries, many of which have been ahead of Canada's trajectory, helps us to anticipate what we might expect to see here in the coming weeks. Several Western European nations that experienced resurgence are seeing hospitalization rates approach or surpass the height of the first wave, which is causing immense strain on their health systems, national and regional. By mid-October, in response to surging hospitalizations, these countries close non-essential businesses and ask citizens to limit outings to essentials while keeping schools open. As a result, some countries, including Belgium and France, are beginning to see a decline in disease activity.
Slide 11. As with hospitalizations, deaths are late indicators of COVID-19 severity and can lag behind increases in reported cases by several weeks. Over the past week, an average of about 70 deaths have been reported daily, marking a notable increase over the last several weeks. Our most elderly citizens continue to be at high risk due to both outbreaks in long-term care homes and increased disease transmission in the community. Recently, a few deaths have occurred among individuals in their 30s, serving as a reminder that young adults may also experience severe outcomes of COVID-19. As more people become infected, we will observe increasing numbers of these rare events.
Diapositive 11. Tout comme les hospitalisations, les décès constituent
As with hospitalizations, deaths are late indicators of COVID-19 severity and can lag behind increases in reported cases by several weeks. Over the past week, an average of about 70 deaths have been reported daily, marking a notable increase over the last several weeks. Our most elderly citizens continue to be high risk due to both outbreaks in long-term care homes and increased disease transmission in the community. Recently, a few deaths have occurred among individuals in their 30s, which serves as a reminder that young adults may also experience severe outcomes of COVID-19. As more people become infected, we will observe increasing numbers of these rare events.
Slide 12. Based on Canadian data up to November the 14th, short-term forecasting shows the predicted cases and deaths due to COVID-19 out to November the 30th. Short-term models continue to be accurate in predicting the growth trajectory. The graph on the left shows the predicted number of cases could be in the range of 366,500 to 378,500 by November the 30th. The graph on the right shows the predicted number of deaths could be in the range of 11,870 to 12,120 by November the 30th.
Diapositive 12.
Based on Canadian data up to November 14th, short-term forecasting shows the predicted cases and deaths due to COVID-19 up to November 30th. Short-term models continue to be accurate in predicting the growth trajectory. The graph on the left shows the predicted number of cases could be in the range of 366,500 to 378,500 by November 30th. The graph on the right shows the predicted number of deaths could be in the range of 11,870 to 12,120 by November 30th.
Slide 13. The longer range forecast shows how the epidemic could evolve in Canada over the next 2 months. What we're aiming for is the safer blue line trajectory. This will require combined effort of individual Canadians and public health authorities in order to sufficiently reduce the current number of people we come into contact with each day. For individual Canadians, this means, whenever possible, reducing the number of people we come into contact with each day while maintaining hand hygiene, physical distancing, and face mask precautions. For public health authorities, this means implementing time-limited restrictions and control measures to further reduce the number of people coming into contact each day across the population. Without sufficient reduction in contact rates, we are forecasting to have 20,000 cases daily by the end of December, with an attendant increase in hospitalizations and deaths.
Diapositive 13.
This longer-range forecast shows how the epidemic could evolve in Canada over the next 2 months. What we're aiming for, the safer blue line trajectory, will require combined effort of individual Canadians and public health authorities in order to sufficiently reduce the current number of people who we come into contact with each day. For individual Canadians, this means that wherever possible, reduce the number of people we come into contact with each day while maintaining hand hygiene, physical distancing, and face mask precautions. For public health authorities, this means implementing time-limited restrictions and control measures to further reduce the number of people coming into contact each day across the population. Without sufficient reduction in contact rates, we are forecast to have 20,000 cases daily by the end of December, with an attendant increase in hospitalizations and deaths.
Slide 14. The only way for Canada to stop the rapid growth of COVID-19 and keep our health, social, and economic systems functioning is for individuals and public health authorities to work together. This won't be forever. Recently, there has been some very good news about vaccine development. Keep this beacon of hope in mind as we all come together apart to do what is needed. Right now, every effort you make as an individual matters. Our best protection for ourselves, our families, and communities is to limit errands and outings to the essentials, keep in-person social activities to your existing household, and strictly and consistently follow public health measures. This includes planning ahead for safer holidays to ensure that we consider the risks, limit our in-person contacts, and get creative so that we can still have meaningful celebrations that are so important for maintaining our traditions and social connections. Thank you.
Diapositive 14. Le seul moyen pour le Canada
The only way for Canada to stop the rapid growth of COVID-19 and keep our health, social, and economic systems functioning is for individuals and public health authorities to work together. This won't be forever. Recently, there has been some very good news about vaccine development. Keep this beacon of hope in mind as we all come together apart to do what is needed. Right now, every effort you can make as an individual matters. Our best protection for ourselves, our families, and communities is to limit errands and outings to the essentials. Keep in-person social activities to your existing household and strictly and consistently follow public health measures. This includes planning ahead for safer holidays to ensure that we consider the risks, limit our in-person contacts, and get creative so we can still have meaningful celebrations that are so important for maintaining our traditions and social connections. Thank you.
Thank you, doctors. We'll now take questions, starting with questions on the phone, 3 questions, and then questions in the room. Minister Haidu will be with us until about 10 o'clock, and then we'll have the doctors for a further 15 minutes. So we'll start with 3 questions on the phone, 1 question, 1 follow-up. Over to you, operator.
Thank you, merci. La première question nous vient de Raymond Fillon.
The first question is from Raymond Fillon, TVA. Please go ahead. Good morning. Thank you. Question. When we look at the map of Canada in your document, almost all of Quebec is in dark blue. Given this context, are you comfortable with the easing of confinement restrictions that will allow people to meet between the 17th and 27th of December? Answer. Thank you for the question. As I've said many times, it's really the provincial public health authorities who best know what's happening in their field, in their area, that is, in the province of Quebec in this case. I heard what Premier Legault said yesterday, and from what I understand, this is a sort of social contract among all citizens, between the citizens and the government of Quebec. Limiting contacts and even self-quarantining for a week before having family gatherings, which will be smaller than usual, that is, means that we could have smaller, limited social gatherings during the holidays. I think we really need to start today to do things individually and government-wide. That is, but I agree with what the government of Quebec is starting to do. Question. When you look at the current situation, would you be comfortable celebrating with other people if you had family in Quebec? Answer. Well, it's hard to say. It's very important for every person to take a look in the mirror and assess their own risks. It's a matter of tolerance, risk tolerance as well, risk management. I should say that my in-laws are from Quebec, and I love social gatherings during the holidays, as we've done every other year, meeting the in-laws. However, this year we will only be the immediate family, that is, with our children. We won't be meeting our wider family. My son lives in Montreal. I said, are you ready to go into quarantine, voluntary quarantine for 2 weeks before leaving Montreal to leave and come home to Ottawa? He said, yes, I'll be doing that. That's a good plan. But as I said, we'll only be having the immediate family at home. We'll be nonetheless wearing masks, physically distancing, washing our hands frequently. That's an example of how people can plan, and that's my own personal plan.
Thank you, merci. Next question is from Ryan Tumilty from the National Post. À vous la parole. Please go ahead.
Yeah, good morning. I'm wondering, with the projection of 20,000 cases per day, that's the course that, as I understand, we're currently on, would that overwhelm our healthcare system?
Maybe I'll take that question. This is Teresa Tam. Even right now, the healthcare system in certain jurisdictions, certain cities are already feeling the pressure. So if that's happening now, you can imagine that these exhausted healthcare workers, are not going to be able to cope. And right now, what I heard is that some of the local jurisdictions are already scaling back elective procedures, surgeries, as their cases go up. So that's one of the first steps that shows that there's already pressure on the current system. So with the trajectory, that's going to be really difficult for them. But what we're trying to say is don't get there. You can bend it, follow that blue line, and you'll be below the 10,000 cases. Also, just to reflect on some of the previous question too, so what you're seeing as a snapshot is what happened a week or two ago. We do know that some jurisdictions have applied some increased restrictions. So we will try and see what that looks like. For example, provinces like Manitoba that actually, and of course Nunavut having had its cases, so that the colored map doesn't reflect, what might be happening right now. It reflects what actually happened a week or two ago as well.
And then just to follow up, and you sort of touched on this already, but the restrictions that we have seen so far, are they enough to bend the curve down, or do you think public health authorities in some parts of the country have to take bigger steps?
Well, I think, we look at things at the national level, and the projections, what I've projected is we are not on a good trajectory. So I think across the board or across Canada, we have to say that the time is now with urgency that we limit contacts. However, that is being done at the local level. That is the underlying principle. Keep those contacts down by restrictions, and of course, each individual doing their work. The other message, which may not have come through this presentation, but we've been saying repeatedly, is that as things escalate and you're going to put in measures, do it fast, do it early and do it fast. So that is, for areas that haven't observed the increase yet, that is really important.
Next question.
Thank you. Merci. Lina Dib, La Presse Canadienne, à vous la parole. Please go ahead.
Oui, merci. Dr. Tam, I was wondering,
The Canadian Press.
scenario, the orange one in slide 13, have you quantified what is an increase of contact? What percentage of increase are we talking about?
I know that in the past when we're trying, this is a model that comes of the Simon Fraser University, and with the orange line, what it's telling you is don't go there. Everything that we do now has to be avoiding that situation. It's very difficult to quantify, and the confidence intervals and things like that will be wide as you look at that trajectory. So it's difficult to say, but absolutely do not go above what we have now. Otherwise, we are in really in trouble. So we are focusing on I think it's the gray line that's in the middle, the current trajectory, to send that urgent message to people to reduce contacts. It almost doesn't matter how many percentage you increase. It's just not good to go above what the current level. And then, of course, you can. We've seen, look at the European countries. We've just shown you France, Belgium, and others that were having a massive increase. And with some of these restrictions, we know it can improve. And so I think that's the underlying message.
It's Dr. You maybe going to just add to that as well. I think what we've been saying all along is that it really is a matter of mobility, both the number and the degree of contacts. So I think it's not just about public authorities and what they do with, be it bars and restaurants. It's for every single individual citizen. If individual citizens decrease, quote, the degree and number of contacts, and it doesn't matter, you can talk theoretically about a certain percentage, that's what's going to drive it down in terms of hopefully the incidence of cases. As Dr. Tam and I have said, is that, if it's certainly the cases continue to increase, then it means that unfortunately with the current, let's say, measures in place and also the activities of individual citizens, that hasn't been enough. And that's why at some point you might need to put more restrictive measures in place. That's what we're seeing in Europe. And you can see that, if you get to the most restrictive measures, you will see a difference and the rates will go down. But hopefully here in Canada, we won't get to that point, but we're certainly close to that, if not in some places already at that point.
Okay, so Dr. Tam, when you're saying we don't go above what we have now, you're talking going above more contacts. I'm assuming that's what I understand. So can you have an idea of what impact those 4 days of gatherings in Quebec that were given a green light yesterday would have as an effect?
It's maybe it's Dr. New. Maybe I can speak to that. I think what the government of Quebec, what Premier Legault said yesterday, I think it's important. I think he is actually saying the same things that we've been saying, that it's not just the governments alone. I think he's appealing to the individual citizens of Quebec, saying, hey, it's a bit of a social and moral contract. I'm not sure if I'm using the right wording, that if people really limit their sort of number of contacts, sort of even the week or so before and the week or so after that, then yes, then to a limited degree, then yes, let's try and have as not close to normal, but at least a kind of a holiday sort of season with the 4 days you're talking about around Christmas to have those smaller gatherings. But even then, it's not to the same extent. And I know I've already mentioned before, with my in-laws, it won't be the type of large family gatherings, which I know are so important, especially in Quebec. It'll be more limited. So I think it's a bit of a do your homework now before the holidays. Then you can have some limited get-togethers during those 4 days, and then afterwards as well. Maintain strict measures, and then hopefully everyone will get out of it okay afterwards. Thank you. En français, je pense que ce que le Premier Legault a élaboré est assez
I
bon
think
comme une
what Premier Legault came up with is sort of an agreement or a discussion between the citizens and the government of Quebec. If everyone is ready to self-quarantine 1 week, 2 weeks before the holidays, then it can be possible to take 4 days holiday to celebrate with the family. However, these family gatherings should be smaller than usual. And then the week after, it's very important to continue to maintain good health practices, that is, limit the number of contacts, etc. I think this is a good balance, the balance that we're seeking to maintain a certain level that would prevent a surge, another surge.
Hi, doctors. Mackenzie Gray with CTV News. In the U.S., Dr. Fauci has said he's urging a uniform virus strategy, not a disjointed move by states. In Canada right now, it's quite clear that there is a disjointed approach to COVID-19. Just recently, BC mandated masks, despite the fact that in Ontario, for many months, masks have been mandated inside. At this point in time, with such dire warnings in the modeling today, do both of you think that it's time for a national uniform approach in how we deal with COVID-19?
Well, I think the core public health measures are, we've said it so many times that we probably don't have to repeat them again, and every individual should be following those measures. I think what you're talking about, whether it's mandatory or not, it really is down to the individual provinces and localities. And I've always said the local medical officer probably knows their population best. However, learning from other jurisdictions, sometimes mandatory helps everyone. It takes the guessing work out of people. It just makes life a lot easier for businesses and for individuals. So I think that's where I think BC has come to its conclusions. And they have had different epidemiology. But if you looked at the map now, there's a more homogeneity now in the experience amongst provinces outside of the Atlantic and some of the territories, but even the territories are getting impacted and putting in more stricter measures. And so I think that what you will see is, in fact, that things are actually getting more homogeneous, even from a public health perspective, measures, given the epidemiology is evening out, not in the right direction, by the way, but across the country.
Anything to add to that, Dr. New?
Nothing really more to add. I think maybe just to build on what Dr. Tam said, we've been meeting regularly. I think just this week we had our 100th teleconference with the Special Advisory Committee. So those active discussions with our counterparts in the provinces and territories, we've always been on the same page with the science in terms of how it should be applied. But as Dr. Tam has said, that at the end of the day, it really depends on the situation at a local level, also maybe at a provincial level in terms of the context, the population, as to how, quote, the principles are best applied.
Ms. Haidu, the Ontario Health Minister, the Ontario Premier, the Quebec Premier, the Minister of Social Services in Saskatchewan, and Dina Hinshaw in Alberta have all said that Canada is going to receive 4 million doses of the Pfizer vaccine and 2 million doses of the Moderna vaccine between January and March. Doug Ford said he got that information from the health department, yet yesterday the Prime Minister refused to give that information. Can you come clean with Canadians now and say if we are going to get those doses of the vaccine by the date that 4 provinces have said we are going to?
Well, thank you. And, listen, the delivery schedule is one thing, and then the successful delivery of the vaccines is another. Obviously, the premiers are working on documents that we're sharing with provinces and territories as we work through the distribution plans. I think the assertion of the various provinces around the number of doses that they are going to receive in their own jurisdictions is the area where we have not come to an agreement on yet. Provinces and territories, along with the federal government, have negotiated sharing agreements for all of the things that we've needed for the pandemic, whether it's personal protective equipment or testing, and we'll do that with vaccines as well.
The number of vaccines that Canada is going to get, not what the provinces are getting. We understand that that's up in the air, but this is an agreed upon number that 4 provinces have said. I do not understand why you cannot confirm that number.
We'll get the numbers to you. I don't have the exact number of doses here, but all I'm saying is, look, I think the point of disagreement is the number of doses that the provinces and territories are projecting to get themselves. And again, I'll repeat, we will be working out and are working out with the provinces and territories a sharing agreement on the number of doses each province and territory can expect to receive when those vaccines arrive in Canada. There are a number of steps to continue to go through to receive those doses on Canadian soil, including the regulatory reviews, which are underway, by the way, right now for Pfizer and Moderna. And as we work through the agreement with provinces and territories on how we will share those doses, we'll come back to Canadians and be very clear and transparent. En français, si possible. Je peux essayer.
Answer repeated in French. We have a procedure with the provinces and territories to distribute the medical equipment. For example, testing equipment, personal protective equipment, and the same holds true for vaccines. We have a system. We speak together, make decisions regarding access to these vaccines.
Thank you. Next question.
Oui, donc c'est toujours pour vous, Madame la Ministre.
This question is still for you, Madam Minister. I'm from Radio Canada. Question, you talked about vaccines a bit. Do you have any indications that Pfizer today will ask for its candidate vaccine to be approved, as has been done in the U.S.? And also, I'm wondering how many doses we can expecting to have. Do you have numbers for the country and when they will be coming? Answer. The good news is that Pfizer has applied to Health Canada for the approval of its vaccine. We do have a process called the rolling review process for vaccines. Manufacturers can provide the data.
We review the data as we see it. In terms of doses, we'll have more details on doses as we move forward.
Oui, donc une question pour le docteur New ou Dr.
A question for Dr. New or Dr. Tam. You mentioned
in
in your tables that when we look at the curves in other countries, for example, in Europe, there has been a number of hospitalizations when stores have been closed. For example, there have been fewer outings, schools were closed. Is that what we'll have to do here? And at what point will we have to reach, that is, before you suggest that that's what needs to be done here in Canada? Answer. I can begin. As we've mentioned several times, it's really the provinces and territories that know their own situation, the reality of what's happening on the ground, and they will be making the decisions, the appropriate decisions for their context. If I may make a personal observation. What's happening in Europe, in France, for example? France is a country with a high population density. It's much different than Canada. Canada is a very large country. If you look at what's happening in the territories, in the Atlantic bubble, in BC and in Quebec, well, it's completely different from one place to the other. I think it's important to always learn what's happening in other countries, to learn from their experiences, and also see what measures have given good results. Here in Canada, the provinces and territories have begun to implement measures based on the reality on the ground.
Thank you. Next question.
Hi, Marika Walsh with the Globe and Mail. I'm just trying to understand where you see Canada going. I understand that you want us to go on the blue line. I would say that the numbers the modeling you released 3 weeks ago and the ones you're releasing now shows we're somewhere between the gray and the orange line. So where is Canada going in your estimation, and how does that compare to, for example, Europe, the countries that you put in the slide as well?
So I think a little while, maybe it was a week ago, we were saying that by the beginning of December, if we go on the current trajectory, we'll see 10,000 cases a day. That aligns with some of the sort of doubling time, if you like, in each of the jurisdictions as well. So we're now, 2 weeks ahead. But we have seen some jurisdictions having put on some brakes, right? So you've seen the curves of the 6 provinces, and we've seen some increase in measures. And I mentioned Manitoba just because they did just put in some amazing, more restricted measures. Now, of course, that takes a little bit of time for us to see whether it has an impact. And I expect that it will, because if you looked at the European countries, we know how this virus is spread through interactions. Once you start limiting them, I expect that we will see some of those curves beginning to bend. But we can't release the brakes rapidly unless we're absolutely certain that other measures have been put in place to control or limit that spread. So I think that's the really important thing. So I think that we are still I actually think we're probably on that gray trajectory, because we're at about 5,000 or just under 5,000 cases a day right now. But things could change. Other jurisdictions have also increased the measures. So you've just heard British Columbia and others. But this is really important because the country is heterogeneous in its epidemiology and the timing of those breaks. And so the composite picture is at the national level is depending on that. So I do think we're on that gray line right now, and we have every chance to bend the curve. We must not increase our contacts, but in our messaging, by restricting your sort of non-essential travel, restricting your non-essential contacts, like keep to your household. Household doesn't mean your, university student son who's living somewhere else. Household means the people that you've been living with in the last 14 days. Keep to those and just right now, because that is going to reduce the contact rate substantially. Some jurisdictions are currently still keeping schools open because they haven't observed sort of really important transmission in the school setting. The schools are reflecting the community transmission. But because your kid is going to school, you've really got to then reduce the other contacts that you have. So I think that's the message. And going into the projection going to the end of the year. So you're going through the Christmas period and to New Year's Eve, let's just say. Really, in order to get to the blue line, we've got to sustain the restrictions. But if we bend the curve fast in the next weeks, well, let's just see what happens before the Christmas vacation. But as Dr. New also said, it's going to be a very different Christmas. I was going to say, in fact, having the talk, it takes on a different meaning right now. You have to have the talk with your son who's coming home, like in Howard, Dr. New's case, have the talk because I was just thinking, you have to plan ahead and be really firm because sometimes you can't refuse your family members and it's really difficult. But have that firm talk, and it's a difficult one. Make your expectations known. Like if you're a high-risk person, you could actually refuse some family members. If some family members are coming in as a guest over the Christmas vacation, you have to take certain measures, some of which might include limiting contacts for 14 days before you go visit your older relative. So if people are going to go back and visit their family, then take these measures. Tell your guests in your small gathering, if that is where you're going, that you expect them to wear a mask. They're going to be sitting at the other end of the dining room table with, maybe sometimes outside if part of it, your weather allows. But wear your mask, washing hands, use a different washroom to everybody else might be your expectation. So have the talk with people. And so, so I think, our message at this point, if you looked at that projection, is really limited to your household for celebrations. For people who we know it's important to get other maybe contacts with their family because they're lonely and their elderly relatives, take those measures to really reduce the risk if you're going to do that.
Just before the follow-up, Minister Haidu does need to leave now. The doctors will still be here. I'm sorry.
If he can go first and get Haidu, I'll come back for my follow-up because with Dr. Tam.
Okay, go ahead, David.
Sorry, Minister. David Aiken, Global News. Prepare for the worst, hope for the best, disaster planning 101. I've heard Dr. Tam talk about every chance to stay in that blue line. Are you preparing for 20,000 cases a day? Do we have enough PPE, ventilators? What about isolation accommodation for people in Nunavut, those sorts of things? Can you speak to your government's plan to prepare for the worst?
Absolutely. Thanks for the question. I am exactly that kind of person in my own life. I've sometimes mocked by my family for my worst case scenario planning, but we have been doing that. Obviously, it's, the federal government is not in the business of delivering direct health care, but we've been building up our capacity to support provinces and territories with surge demands for a very long time over the summer months, et cetera. In fact, we have a number of supports deployed right now to Ontario, Quebec, Alberta, Manitoba, including Red Cross personnel, extra testing capacity, in some cases, isolation centers that the provinces, territories, and local public health are running. Obviously, contact tracing, and of course, we'll be there for whatever they need to deliver in their healthcare responsibilities. the provinces and territories, the health ministers, we also meet. I don't have the exact number of times that we've met, but we meet weekly to talk about what kinds of needs that they're anticipating in managing their own surge and how I best can be positioned to support them as the federal health minister. And so we continue to build up that capacity. But I'll just say this, it's not limitless, as we know. And the biggest limiter is actually healthcare resources, people, healthcare professionals, because as we know, those are hard to find. It is getting increasingly difficult for healthcare workers across the country, including frontline healthcare workers, pharmacy workers, personal support workers, as people have been working flat out for 10 months and are exhausted. And that is a limiting factor for all of us.
Follow up?
Mine's for Dr. Tam. So if Dr. Administrator.
Thank you very much.
Marika, you can continue.
Tam, the other thing that struck me from your modeling is this, what you're calling the larger and more outbreaks in long-term care. Can you speak to whether local healthcare systems have learned the lessons of the first wave and whether we are on track for repeating what happened in the first wave in long-term care?
I think that is such an important part of the response. You've got to do everything to reduce the risk of introduction, rapidly detect if you had an introduction, test widely in those settings so that you can prevent the impact. So as we started through the beginning of this resurgence, we were not seeing that many long-term care facility outbreaks, and they had smaller numbers of cases. What we're seeing now is that with increased community transmission, the numbers of long-term care outbreaks have increased, and the numbers of people affected in those facilities or those homes have increased as well, which is a really worrisome trend. But again, we know what to do, and people just need to double down to support those. As Minister Hajdu has said, some of the sort of challenges, I think, is health human resource. So having the trained staff to support those jurisdictions, which is a difficult thing for the local jurisdiction. At the federal level, we have engaged the Canadian Red Cross and others to try and support those efforts, whether they support long-term care, supporting testing, and supporting isolation measures, providing voluntary isolation sites. So, I mean, the key is, as you say, right now, we kept sort of saying that the deaths are the lagging indicators. We're not necessarily seeing the impact of the current acceleration in the community on our most vulnerable. So absolutely, we need to do better. I do think things have improved in many areas, but there are some long-term care facilities in particular that are having some repeat outbreaks. So those are the ones that at the local level, they, I think, need to focus on and again, do whatever they can to improve the situation.
So you don't think we're repeating the first wave? Are we on track to repeat it or are we not?
I don't know right now. And you can, as I said, you can sort of stop it and put the brakes on. I do think that many long-term care facilities are doing better. But there's a limit to how people can cope, so that we all have to do our best to reduce community transmission to the extent possible. I also think that we have many other tools now. So as we've sent out quite a large number of rapid tests in the jurisdictions and point of care diagnostics, the application of some of those in the high-risk settings would be very important, I think, in reducing it. No, we're not on that trajectory the same as the last time, but we can't go there.
Thank you, Dr. Tim. Just a quick reminder that it is one question, one follow-up. David will take your follow-up now.
Yeah, and I just have one follow-up, Dr. Tam. So the last slide was about all the things we can do, but in your comments on the slide where you talked about testing rates, you mentioned that we're not doing enough testing. Could you elaborate on what the problem is at this point, so many months in, on why aren't we doing enough testing? Is it because we aren't showing up at testing facilities and there's unused testing capacity? Or as I suspect, there's not enough testing capacity? Can you tell us what we're doing about fixing the testing problem?
Well, I think, at the federal level, our role is to provide support to the provinces to, we've actually been acquiring, the regulators been doing what they need to. We've acquired a lot of tests. We've now deployed them. There are guidance for their use. So part of it might be just at the local level, figuring out the operationalization of those new tests that we've implemented. The other thing is that we do know provinces have augmented their capacity, even for the PCR tests, quite a bit higher than the rate that they're testing on a daily basis. I actually think the reasons can only be described by the local authorities, but some of the observation is that we need to, again, support people to get tested. So access, I would say access in the most areas at the highest rate. So some of it might be more creatively. I know that in some jurisdictions, they're beginning to look at, well, what about those mobile sites? What about opening more sites? So access might be one. Two is we need to ensure that people are still encouraged to get tested. Not everywhere, but some jurisdictions have said that people want to keep going with work sometimes, even when they have symptoms. They're worried about their work and job security. They're worried about, keeping things going. We want to make sure Canadians hear the message, I think, from across the country, that if you have any symptoms, go get tested. We must not stigmatize populations that are experiencing outbreaks. We must encourage them and provide them with the testing necessary. So there may be a variety of different reasons, but I think we will do what we can to help. One encouraging thing is that with some of the point of care testing, they have been deployed to the rural and more remote areas. Nunavut is able to do their own on-site testing, whether it's Rankin, whether it's Iqaluit. So and they've been rapidly trying to test the communities using their own capacity right now. So we're behind them if they need it, but it seems that they've augmented the capacity. They are able to test those communities. So it will be different and varied, I think, across the country as to why we're not seeing wider testing. But, we will be trying to encourage more of that.
Thank you, Dr. Tam. We'll turn to the phone now for one question before coming back to the room. Operator?
Oui, merci. La prochaine question est de Hélène Buzetti de Devoir. Vous la parole.
Next question from the Devoir. Please go ahead.
I know the question has been asked, but the answer was not super clear. So I'd like to get back to the situation in Quebec. I'm just wondering, is the permission given to gatherings of 10 person, is it more susceptible to get us closer to the orange line versus the gray line on your graph?
So I think the concept is to reduce the number of interactions. So whatever you can do to reduce that. It's difficult to quantify because it's a combination of the gathering size, but other interactions as well. So yes, by limiting further the gathering size is going to help. That national level and super high level sort of projection cannot take care of every single sort of scenario in different settings. But yeah, by limiting any gathering size to smaller numbers is going to help for sure.
Yeah, as Dr. Neal would add, I think some people maybe are fixated on sort of, the 10 or whatever number for the actual sort of get-togethers during, the 3-4 days sort of around the Christmas holiday. But I think the important thing that the Quebec authorities are also putting forward is sort of what people should consider and think about doing sort of before and after. And I've heard about sort of this limiting or sort of a self-quarantine for the week or so before those 4 days, and then as well afterwards. So I think all of that put together, I think the message loud and clear is really limit as much as possible your contacts, keep it to your household. But, we know that the holidays are important for many reasons, socially, culturally, and especially also in Quebec. And so by putting a certain sort of parameters in place, I think what the Quebec government's trying to do, but I think it's across the country as well, is have people think about how can you have a safe holiday to the extent that it's possible now in the time of COVID-19. That won't be obviously the same as we've had in previous years.
I understand all that, Dr. Tam, but you said that we should be looking, trying to limit the size of gatherings. So my question is very simple. If we do have those gatherings of 10 people, should we expect the number of cases to increase in Quebec?
So I think limiting any gatherings at the moment in the areas with high rates is really important. So 10 is just a benchmark, but I would suggest that you need to, reduce that as much as possible. So I think, by that reduction, you will see a reduction in community transmission. It's not just the number, it's who's in it and what are the people doing in that group of 10. Because if you're all wearing masks, distancing 2 meters, practicing all the hygienic measures, that's very different to 10 people mingling without a mask and doing whatever they want. So it's not just the limit size, but it does help to have a benchmark so that people can have in their heads that it cannot be big.
Yeah, it's Dr. New. I think maybe just add to that, as we've always said, that there's no single measure that's going to prevent, obviously, transmission. So it's all about a layered approach. And so if people practice all of the good public health measures, be it a gathering of 5, 6, 7, or whatever, 10 people during those days of the holiday season, that's fine. But as I just mentioned, what I think the Quebec government's also doing is that the other layer is that if the people, let's say, who are planning to get together, be it 6, 7, 8, 9, 10, or whatever, are also taking additional measures before they get together, sort of like the week or so before in terms of a self-quarantine. That'll be an additional sort of precaution or measure that would also help limit potential for transmission. Thank you.
Thank you, Dr. New. We're getting a little tight on time, so I'll turn to the room for one more question. David?
Hi, David Thurton, CBC News. Thank you so much for answering all of our questions. If we increase our contacts, as the modeling says we shouldn't, because we will see an explosion of cases, are we on track to see an outbreaks the kind that we've seen in the US?
Right now, our rates are lower than in the United States. Of course, if you increase your contacts, you could see similar rates to some areas of the United States, for sure. So that you need to sort of avoid that. By limiting sizes of gatherings, going back also to just build on the last question, and in some cases restricting businesses where there's 3 C's, close contact, crowded, and where you have lots of face-to-face shouting, singing, panting. One is trying to reduce the chance of those super spreading events in large clusters. So I'm not sure whether you meant that as outbreaks, but so these kind of measures that jurisdictions are putting in now should be they're all trying to limit the size of those outbreaks and also limit the impact on the public health system who are having trouble contact tracing. So one of the parameters that we've been tracking is how many cases are unlinked to others. And that's been tracking at least a third, in some areas higher. What that's telling me is we could track the long-term care outbreaks. That's easy. Every one of them are reporting. Even one case is an outbreak. Schools are easier because it's a specific set of people. The other outbreaks are much more difficult to track, not necessarily because people don't want to report it into us, But because you're having quite extensive community transmission, you can't link the cases back to specific settings anymore. It's not like when we're trying to put out the sparks at the beginning of the fall. So now you have community transmission, and that is what you're trying to do in a holistic way to reduce the context. So in some areas, they are unable to trace back to specific settings. And that's actually why I think the brakes are being put on now. You need to get back to a point where you can now have tests, much more, able to trace your contacts and isolate them. You need to get back to that point.
Okay, totally different question. Your meeting last night with the leaders of the federal parties, what was that like? Would you like to see more of those kind of meetings, and would you like to see more cross-party collaboration and discussion and something akin to a national task force, as some leaders and some people within the medical community have called for?
Well, I think it's very important to work together. And, I think I'm happy to provide, supports that is needed to make sure everybody understands the situation. But the briefing was very much like what we're doing now, really, in terms of presentations and questions. So I think, and then people take out of it different messages. People can look at the same set of information and interpret them in different ways. So by having these conversations, it's just to increase understanding of the situation. But now is the time for, again, a whole of society response, and that anything that we have to do to increase, I think, what I call social cohesion is really important. That's what happened in the first wave. That's what happens in countries that are able to manage the outbreak, is actual cohesion in our country and our society. So I think that is a really important thing to do.
Thank you, Dr. Tam, and thank you, Dr. New. That concludes today's press conference.